This is the patient assessment medical skill. In this skill, you have 10 minutes to perform your assessment, patient interview, and voice treat all conditions discovered. You should conduct your assessment as you would in the field. Do you have any questions?
No.
All right. You were dispatched to a private residence for an 80-year-old male with a chief complaint of chest discomfort.
Okay. We'll start off with standard precautions, ensure that the scene is safe. Appears I have one patient. Based off dispatch, we'll say that this is a nature of illness. I'm going to consider the need for additional resources as well as C-spine. Walking up, forming a general impression, looks like I have a male in his early 80s, apparently, clutching at his chest. Sir, hello, my name is Mark. I'm an EMT. I got a few questions for you, sir. What's your name?
My name is Jesse.
Jesse, what city are we in?
San Diego.
What year is it?
2020.
Okay, and why'd you call us out here today?
My chest is really hurting.
Okay, so Proctor has a chief complaint of chest pain. I'm looking for any life threats. Do I see any life threats?
No life threats.
Okay, so we can assume that this patient has a patent airway because he is speaking to us. I'm looking at the rate and tidal volume. What do I see?
Adequate rate and tidal volume.
Okay, let's get a O2 sat on him. What's the O2 sat read?
93 on room air.
Let's get a nasal cannula. I'll have my partner set that up. We'll start at 2 liters per minute, and this is just to help you breathe a little better, bump those O2 sats up above 94%. Looking at the skins right now, what do I see and feel?
Pale cold diaphragmatic.
And just a quick verbal blood sweep, visualize anything, no major bleeding?
No
Okay.
major bleeding.
And a quick radial pulse.
It's strong and rapid.
Okay. So based off the patient's presentation with his skin signs, with the low O2 sat and the chief complaint of chest pain, we'll go ahead and make this a priority patient. We'll expedite transport as soon as it's available. Start off with my history. Sir, I've got a few questions for you.
Okay.
What were you doing when this chest pain started?
I was out mowing my lawn.
Okay, did that come on suddenly or gradually?
Pretty gradual. It got worse.
Okay. Anything make the pain better?
A little bit when I sit down, but nothing really helps.
Okay, does anything make the pain worse?
No, it's just getting worse and worse.
Okay, if you could use a couple descriptive words, maybe tell me how the pain feels. How does it feel?
It's like just really a lot of pressure on my chest. Yeah, it just feels like pressure.
Okay,
Pushing down.
a little bit of pressure there.
Mm-hmm.
Now, if you were to rate this pain on a scale of 1 to 10, 10 being the worst pain you've ever experienced in your life, 1 being no pain at all, where are we at?
About a 7.
Okay,
Yeah.
now can you point to that pain?
It's like right here.
Okay, does it move anywhere else?
A little bit in my back and my shoulder.
So it kind of radiates from your chest up to your shoulder,
Yeah.
your back?
Yeah.
Okay, and how long have you been experiencing this pain?
About 15 minutes now.
Okay, just a couple of clarifying questions for you. Are you experiencing any shortness of breath?
No.
Okay, any lightheadedness or dizziness?
I'm a little lightheaded.
Okay,
Yeah.
so I've got a few more questions to round out the history.
Okay.
Are you allergic to anything?
No.
Okay, and are you prescribed on or currently taking any medications?
Yeah, I have aspirin and nitroglycerin from my doctor.
Okay,
Both of these.
so sir, I'm just going to take those from you for the
Okay.
time being here. Just set them down here. We might revisit these in just a moment. Okay, and what's your medical history look like?
I had a heart attack 4 years ago, and I had to go in for surgery. And I've got a big scar here.
Okay.
And I have high blood pressure.
Okay, anything else associated with the heart conditions, anything you've
I
had?
don't think so, no.
Okay, so just in the last 4 years, you did have that cardiac event, you
Yeah.
did have the surgery take place, but nothing since that.
No, I've been prescribed those ever since.
Okay, and you're compliant with your medications, you take them
Yeah.
as recommended?
Yeah.
Okay. Now, what's the last thing you ate?
I had a sandwich about an hour ago.
Okay, so just a quick recap here. You're out mowing your lawn, you had this sudden onset of chest pain, you do have some cardiac history. Does it feel reminiscent of a heart attack you've had in the past?
Yeah.
Okay.
Feels like that.
Okay, is there any chance you could have been struck in the chest, anything out of normal over the last couple days?
No.
Okay, so at this time we're going to inspect the affected area. So I'm going to remove the patient's shirt and inspect the chest. I'm looking in this patient for any scars, pacemakers, implanted devices, any skin medication patches. Do I see anything?
You do see that surgical scar on his chest, but other than that, skins are clear.
Okay, so now we'll go ahead and palpate. We're trying to rule out if this pain is actually of a cardiac origin or maybe some muscle wall pain. So sir, I'm just going to press on the anterior and posterior portion of your chest. Go ahead and tell me if that increases the pain.
No.
And if you move side to side like this, is there any increase in pain?
No.
Okay. We'll go ahead and auscultate now all 6 fields. We're going to do second and third, intercostal space, midclavicular line, fourth or fifth intercostal space, mid-axillary line, and also the inferior angle of the scapula, all of that bilaterally. What do I hear?
Clear in all 6 fields.
Okay, so we'll go ahead and get a set of vitals now. I'd like to start off with blood pressure, heart rate, respiratory rate and quality, and let's get an updated O2 set.
All right, blood pressure is 150/90. Heart rate is 92. Your respiratory rate is 20, and it's full and effective. And your updated O2 is 95%.
Okay, so we got a set of vitals now. Let's form a field impression. I've got Jesse here, 80-year-old male patient experiencing some chest pain we believe to be of cardiac origin. So from the vital signs we got and from the patient's presentation, we're going to go down the chest pain protocol and assist with his prescribed aspirin as well as nitroglycerin. We're going to start it off with aspirin, and depending on who you talk to, aspirin might be given first or nitro might be given first. We're going to give aspirin first just because it takes a little longer to act. So we're going to go through our protocols here. We do have a standing order in the County of San Diego to assist with the patient's physician recommended aspirin up to a dose of 325 milligrams. And sir, what is your regular dose?
325.
Okay, so you do take the full 325. There's no contraindications for the administration of aspirin besides maybe an allergy that the patient has to aspirin, which we already established he does not have an allergy. So we'll go through the 5 rights. This is the right patient because he is experiencing chest pain of suspected cardiac origin. This is the right medication, aspirin. It's an antiplatelet aggregate. And this is the right dose. It's 325 milligrams. That's going to be 4 of our 81 milligram tablets. I'm going to make sure that it's administered via the right route, which is orally, chew and swallow. And I'm going to make sure that it's not expired. We'll triple check these medications prior to administration with our partners. And then we will go ahead and take the cap off here. Tap 4 of those chewable tablets into the cap. Hand them to our patient. Verbalize the medication there. And you may give a small amount of water, PRN, with that medication. So now we'll move on to nitro. So nitro does have more contraindications. I'm going to start off with those, get those out of the way. So I've ensured that he does have a good blood pressure. For the County of San Diego, the blood pressure needs to be above 100 systolic. We do have a blood pressure of 150, so that's good. National Registry is going to be 90, so you want to mention both of those, National Registry and San Diego County. Make sure that he has a good heart rate. His heart rate's in between 50 and 100. And sir, I'm going to have to ask you if you're on any erectile dysfunction medication such as Viagra, Cialis, or Levitra in the last 48 hours.
Yeah.
Okay. And are you prescribed any pulmonary hypertension medications such as Revatio, Flolan, or Levitra?
No.
Okay. So we've ruled out those contraindications for nitro. Let's go ahead and go through the 5 rights for this medication. We've got the right patient. Jesse, this is your medication, correct? Okay, this is the right medication. It's nitroglycerin, which is a vasodilator. It's going to make that chest pain hopefully subside. The right dose is going to be 0.4 milligrams. The route will be sublingual. Do not chew, do not swallow, just let it dissolve. And then I'm going to make sure that it's not expired. So we'll go ahead and triple check this. State our protocols here in the County of San Diego. We can administer up to 3 doses, including what the patient has taken prior to our arrival. So we'll go ahead and ask Jesse if you've taken any of these prior to our arrival.
Took 1.
So you did take 1, so we may assist with up to 2 doses standing order, as long as none of the other contraindications are met. Good heart rate, good blood pressure. So we're going to go ahead and tap one of these out into the cap. Go ahead, sir, place this underneath your tongue. Do not chew, do not swallow. Just let it dissolve, okay? At this time, we will reassess our patient. Since he is unstable, we're going to reassess this patient every 5 minutes. We're reassessing LOC, GCS, ABCs, and full set of vital signs. And then we will give our handoff to the nurse at the receiving facility. So nurse, this is Jesse, 80-year-old male patient. We found him today at his private residence complaining of a little bit of chest pain. Initially, we found him with an O2 set of 93%, so we did put him on some supplemental oxygen, 2 liters a minute via nasal cannula. As we went through the assessment, we found out he does have a cardiac history. He's prescribed aspirin and nitroglycerin, so we went ahead and treated him per our chest pain protocol in the County of San Diego, assisted him with 325 milligrams orally aspirin, and we also administered 1 dose of 0.4 sublingual nitroglycerin. Here are the vital signs we got before we administered the medication, as well as after the administration of the medication.